Hey there, Dr. Dawn here with a very important tip on injury prevention for all you gym rats or athletes out there. One of the most important things that you can do to prevent injury on a regular basis is to get body work from a massage therapist. However, if you can't do that on a regular basis, your best friend is either a foam roller or a Yamana body rolling ball to get self-myofascial release. And you can do this on a daily basis, whereas you might only see your massage therapist once a week or once a month. Again, this is the best tool for injury prevention to keep everything loose and ready to go for your next workout. All right, so my assistant Kim is going to show us how to do it, and I'll talk you through it. We're going to go over the lower body today, and there'll be another video going that'll work on the upper body. So today, again, the lower body, we're going to work on the IT band, which runs from the side of the hip down to the side of the knee. When you roll, you only roll down to just above the knee and then back up again. We'll roll the outer butt area, and when you roll that, you want to make sure you stay off your sacrum, so you're going to lean to one side and just be on muscle tissue. We'll roll out the hamstring, which is on the back of the thigh. And when you do that, you'll need to keep your butt lifted so that you really get a lot of pressure down through your thigh. And you'll see Kim, and she'll cross her leg over to really get some good weight down through the foam roller. She's going to be using the foam roller today. And then the last one we'll do is rolling out the front of the thigh, or the quadriceps. And that one gives you a little bit of a core work because it's almost like a plank position as you then roll down the front of the thigh. Again, you're going to roll down just to the knee and then back up. You never cross the knee joint when you're rolling out. Okay, so let's get started. All right, Kim's on the foam roller. She's going to start with the IT band. And as you can see, that bottom leg that she's rolling out, you keep nice and straight and aligned with the hip and the shoulder and the ankle, all on one line. And then she uses her other leg in front to push just to the knee and then back. And she uses her hand to push her back up to the hip. And she's on her hand, but you can come down to your elbow if that feels more comfortable and use your forearm. And generally you want to take maybe 4 to 5 passes. So Kim, let's take a look at your outer butt there. And you can see she's leaning over to one side, staying off her sacrum and her coccyx, or her tailbone. Her knee's a little bent, and she's just rolling back and forth. Again, 4 to 5 passes. And on any of those passes, if you feel a spot that's particularly uncomfortable, just hang out there, just like a massage therapist would. All right, so here's the hamstrings. Again, she's starting up at the top by your sit bone. She's got that top leg crossed over to give a little extra weight. And she's rolling just to the knee joint and back up to the sit bone. Nice. All right, so let's go for the quads. On this one, you're going to be on your belly. You want to place that foam roller just above your hip joint, just above that bony area there on your hip joint. You're going to be on your elbows, and you want to really pull your belly in nice and tight so that you don't have your back sagging, and then you just roll down to the top of the knee and roll back. Let me see, I'll get another angle here of Kim's other leg, and she's actually using it to push a little bit. You can see almost like a Spidey move. There, she's got that one leg out to the side as the other one is nice and straight and rolling on the foam roller. Good. Thanks, Kim. All right, guys, there you have it. Some really nice tips on injury prevention specific to the lower half of your body. And again, the next video will be on the upper half. All right. Take care and good training.